So Uta here with a bouquet of all Mystic Spirit dahlias. I wanted you to see them like this in the natural light I have here. Let's see. Oh, there we can get one. Wait a minute. Maybe we can get more. What's the best? Hmm. There. Okay. So this is information that I got from a study um, that was from University Medical Center of Hamburg, Eppendorf, and it was it's some BMC Public Health. The researchers are Catherine Grupp, Marco Blessman, Hans Helmut Koenig, um, and it was 30th of May, 2023. They had 104 um, patients who are female, natal females, and they were had been taking, the testosterone and all this stuff. Um, and this is very common. I'm just going to try to make the point that whenever you see that some study has come out saying that the the research is now showing this wonderful rates of satisfaction after this treatment. I want to first of all say that 104 subjects is really not a big study, but the often what we're seeing now with studies that are being quoted is that some kind of small improvement. There was one out of Australia recently too. Some kind of small improvement is um, manufactured into this wonderful outcome, and that's why we should not be doing alternative treatments to this whole so-called affirmative approach involving not just talking, but you know, puberty blockers, testosterone in females, and estrogen in males. Um, and I'm going to talk a little bit after I just go through this shocking, not happy result. um, uh, I am going to talk a little bit about what I watched on Alexander L. YouTube channel. He's a brave Norwegian detransition man who I think is in his 30s, just like Richie Herron, and he and Richie Herron have a very frank and clinical, really, discussion of what they're dealing with now and how it's not just a situation of, oh, well, we'll put you on exogenous testosterone and then you'll be fine. You won't have some of your parts, but, you can have your psyche back or something like that. But back to this study from University Medical Center of Hamburg, Eppendorf. I'm sorry, I don't have uh, the link. I'm sorry. I am dealing with Clace has a health issue and he may have to have some surgery and things. So I guess I'm a little bit distracted, but I want you to know I did sleep surprisingly well last night, and I've been really trying hard to do my wellness movement series seriously for a good length of time every day, and I started doing it being sort of loose too. I think that's a very good way to help yourself. And it's very important if you are a trans widow, a woman who has ended a relationship with a suddenly cross-dressing man. It's very, very important to get involved in self-care. I did quite a bit of self-care when I was going through this, but I did not realize um, how it was mostly, vigorous exercise. And I got a couple of injuries. My neck went out once, my back went out. Um, and it was difficult for my muscles to let go once they had gotten into spasm. And there are so many stress-related problems that we are given. Yes, we all go through life, and stress and anxiety takes its toll. But what they are suggesting, I happen to know, for the women that the therapists are suggesting have to stay to keep the family together, in quotes. What uh, they are doing is prescribing a lot of drugs, and I'm a little concerned now because at least in the U.S. they're tightening up about some of these drugs, and I'm wondering, what is happening with some of the women who stayed. And the longer you stay with someone who is a narcissistic sociopath, um, the more risks for your own psyche are just sort of snowballing and avalanching and building up. I recommend getting out. Um, so this study we had 104 women who thought they wanted to be at the very least on testosterone, and uh, so there was there was 12.9% of them were extremely dissatisfied, and 18.3 were dissatisfied. 12.9 were slightly dissatisfied, and 7.5% were neutral. Um, I think with actually a small subject cohort like this, they actually shouldn't translate it into percent. I'm starting to do that with now that we have more than 50 trans widows, but in general, I like to give the actual numbers. Um, so this added up of extremely dissatisfied, dissatisfied, slightly dissatisfied, or neutral, I don't really feel any better, is over 50% of these women who went on to testosterone. How can that be worth the risk? 51.7%, more than half, really no improvement. And then only 1.1%, so that's maybe two people, only two people perhaps in 104 people, were extremely satisfied. We're going to risk, 102 other women, or at least maybe 52 other women who it didn't help at all, that they're going to have permanent damage from testosterone. And then 30.1% were slightly satisfied. So if you add slightly satisfied to the 51.7% who were neutral or some version of dissatisfied, then you've got 81.8%. So that's probably about 82 or 83 of the 104 women were either only slightly satisfied or neutral or some version of dissatisfied. Then, 17.2 were satisfied. So maybe 18 of these women, 18 of 104 women who went on testosterone to feel better, uh, you know, and so I can't remember what conclusions they made. There was something else that came up. I had more Transwidow results or something, and I haven't posted about this yet, but um, typically what they'll do is they'll broadcast that they had favorable results when actually no, they didn't. Uh, 81.8%, which translates if the subject number was 104 to probably 82 or maybe 83 women, were only slightly satisfied or else neutral or else some version of um, uh, dissatisfied. And the thing is, so satisfied compared to extremely dissatisfied. 17.2 were satisfied, but 12.9% were extremely dissatisfied. So, um, and I've really been thinking about this, you know, the toll of anxiety and stress physically. As Bessel van der Kolk said, the body keeps the score. And now that I'm trying to do my exercises with a little more looseness, and I'm also paying attention to um, the way I work. If I'm out in the garden and I'm, looking down, which you have to do to weed, I'm really thinking more that I have to have my chin tucked in and be like this as opposed to going down and then sticking your um, chin out. I just am dealing with some tight muscles, and I'm realizing it just took me back to after I got Nettie to move out and I got a couple of jobs, was doing substitute assistant teaching in early childhood centers, and then I got a couple of jobs um, with one with cooking, and then there was one where I was doing the artistic stuff with some of the little kindergarten Gan class, it's called, in the Hebrew school. I was really rushing around. I worked 6 days a week, and that's just not right. That's not right that um, my husband made a change in his identity and his uh, self-image such that um, I have to go do all these things, and I am really the Sherpa pulling the heavy, heavy load. And I know that my neck went out a few times. And what was really um, disconcerting for me is that the male doctor that I went to get some medication for it told me that I'm too nice of a person. I need to, stop being so tolerant or, accommodating to other people, as if that's a useful thing. He was a doctor, not a psychiatrist, and that the problems with my neck are probably there because of my previous career as a professional dancer, and dancers mess up their necks. Now, I really think it would have been useful if he had said to me, "You are under more stress than almost any class of woman, and I suggest that you figure out um, asking your parents for some financial help so that you can get regular massages." I did that for a while, but at that point, I was really, working so hard and holding a lot of tension, and I'm very thankful, and I'm very thankful to anyone who gives good suggestions in the comments. We're up to 1,400 subscribers. Um, and so this study at the University Medical Center of Hamburg-Eppendorf with the Grupp, is the lead researcher. You could probably find it just with that. Um, you know, they are saying, well, we helped so many people. They didn't report any suicides during this, I think it was 18 months, it's not long enough at all. So now I'm just trying to make this point that um, inevitably as you age, you're going to carry stress, and you're going to have imbalance in some muscles. That's just inevitable. Um, but the therapies that I'm doing, I started some uh, Zoom Feldenkrais lessons, which are just really to help with this tension that I'm feeling, um, and I'm doing my movement stuff, and I honestly think that if someone, whether they were a child or an adult, if they would say, okay, well, how about if we first try to make sure that you're really in touch with your body? Because the problem you're talking about might be, and the ideation that you're talking about might be due to these imbalances, actual physical muscular imbalances in your body. So let's do Uta Hagen's a wellness movement series along with a practice like Alexander work or Feldenkrais physical therapy, and and just uh, try to get a connection in the mind with the body when it is in a neutral, relaxed state. I go out and work in the garden and I get sore muscles and so on. But we need to do that. We need to be active. We need to go do our walking and keep strong and have a healthy heart. However, uh, we also need to just really relax, just really and have a neutral state which we can come to, and we're not carrying the activities and worries in our muscles. So I don't know if I'll have time to do it now, but I am going to record some of my movements just with me doing it kind of, extra loose. And I think that that's really important too. And, I would suggest do them so that you're reaching out, to that sphere of harmony that I'm calling it. And then uh, do another set where you feel like I've gathered it in and I've pushed away my stress and worked on that. Now I'm just going to do it loose. I'm in the sphere and I'm going to do it really loose and have my head kind of loosely go around because um, this is so common that we trans widows have like a back that is suddenly in spasm, that our neck goes out, that we have real stress. Like I realized that I'm carrying this stress in this area because I had a nightmare. And the nightmare was a nightmare that I have commonly had for the last 30 years. And it was that I was fleeing in the dark down a road and trying to make a decision whether to run into the woods that the road is going through because I have a pursuer who is chasing me, and I'm not sure whether it would be safer to stay on the road or if I should disappear into the woods. And I woke up gnashing my teeth, not just grinding my teeth, but I woke up gnashing my teeth. And I had to make sure to take some medication to get myself through the first part of the day. I'm better now, and I've been doing this Feldenkrais. If you are able to do this, it's really worth it, and just a mindset that your body um, needs to work to a calm, neutral place. We're trying to do that with our minds when we get out and um, have a walk and do the gardening and see beauty and things like this. But um, we also need to have this physically resting, relaxed place. And I'm just reflecting on my life 25 years ago. I was always on the run. I was trying to save money and walk or bike everywhere and not take public transportation or not take a car service. Now I'm just going to segue briefly into the Richie Herron and Alexander L. conversation of the aftermath of detransition for a male. And this is um, a difficult, uh, it's difficult, that's all. And I'm proud of them. If anybody wants to find them on Twitter, X, I think it's It might be Tulip R is Richie Herron, and Alexander L. Well, you can go to his channel. You can go to their channels. They probably have their Twitter things. I got banned like most trans widows, so I can't contact them directly on Twitter. But so they are both post-op now detransitioners who had taken estrogen for many years. They made their decisions in their adulthood. And then I think Richie Herron, as soon as he woke up in such pain, he knew he'd made a mistake. And Alexander, you can look on Alexander L YouTube channel and see what the chronology is. But I think it is quite a few years now, more than 10 years since he detransitioned. And both Richie and Alexander had tried out going on testosterone because they both had their testicles removed. And they both had that sex trait modification surgery, which is called, very deceptively, it is called vaginoplasty, as if a vagina is something that could be manufactured. So what Alexander described quite poignantly is that when he was on testosterone, that this is post, after the detransition, that the testosterone affected the penile tissues, which were deep inside his body, having been inserted to serve as an ersatz vagina, I guess, for the purpose of sex activity. And what we're hearing in general is that that kind of intercourse is not really happening so much. And knowing that Nettie was just normally sized in his male parts, I can't imagine what he could have accommodated in his tube that was created out of his penis. I have never spoken with him about it, but I think it was kind of described by the doctor in a name change document, which I got a copy of. Now, so what happens to that tissue, that male tissue, when the detransitioned male is taking testosterone, is that it starts to stiffen as if it was still attached to him being his penis and he was getting an erection. And it is not a pleasurable experience for them. And I suppose it could be surgically removed, but neither Richie Herron nor Alexander L. want to pay more surgeons to do more stuff, and both of to do more, it wouldn't really be reconstruction. You can't make a penis. Anyone who thinks that they can do it, any woman who thinks that she can have something that does all the things that the normal male penis does, is absolutely sorely mistaken. So, but I put the link to the Alexander L channel in my community post, and I just think that it's really important to know this, actually, and to go ahead, and if you're in a discussion with some friend and they say, oh, well, they can just go back on testosterone and resemble the man that they used to be. It's really not that at all. And I hope for them both, that they can find therapies that at least help them with the pain. They both have continence problems. They both have trouble urinating, and that should not be happening to a young man. And this combined, this 51.7% neutral or dissatisfied, combined with then if only slightly satisfied 81.8%, it's not sounding like a great improvement. And then for the practitioners, the surgeons to just shrug their shoulders and say, oh, well, you can go back and now you can take testosterone. We've removed your source of testosterone from your body, but it doesn't matter because we'll give you this in an injection or something. Um, it doesn't work. It just doesn't work. And I posit that there is actually no valid diagnosis of true trans. People are manufacturing memories from their childhood, or they're responding to abuse and bullying because they seem like a different kind of a boy or a different kind of a girl. So that bullying should be the thing that we're dealing with, not um, not modifying the person so that they won't get bullied. And they've become the bullies. So I hope this was somewhat coherent. I do have a lot of weeding to do outside, and I will keep you posted about everything and see you soon. Be well.